Welcome to As a Woman, Fertility Hormones and Beyond. I'm your host, Dr. Natalie Crawford, and I am a board-certified OBGYN and fertility physician, and also co-founder of Fora Fertility in Austin, Texas. Each week on this podcast, I discuss health and fertility and how they relate to your true self. Become a part of the community of collaboration that amplifies others as a woman. I hope you enjoy the episode. Hello and welcome to the As a Woman podcast. I'm your host, Dr. Natalie Crawford. Today we are talking all about reproductive health post the election. This is not a political finger pointing sides episode. This is about what can you do and what should you know. I'm getting flooded with questions about IVF and birth control and contraceptive options and fertility planning. And in today's political landscape, we would be naive to not try to understand our bodies better. Regardless if you're trying to get pregnant, prevent a pregnancy, it's really up to you. So a few notes on that. I've got a lot of free resources on my website, nataliecrawfordmd.com/resources. There is a search bar and you can see other podcast episodes or YouTube videos or the blog posts. You also have access to some freebies. There's the TGC Starter Guide. There is a vegan meal kit if you want to dive into plant-based recipes. And there's also the Enhance Your Natural Fertility course and the IVF guide. Today, though, I'm just going to be answering all the questions that I'm getting right now, and I'm going to show you one of them. If you have questions, one thing I love to do is to try to help answer them. I know there's a lot of misinformation and confusing stuff about your body. So you can call and leave a voicemail at 657-229-3672. Again, that is 657-229-3672. Or you can also ask a question on Instagram on Monday at nataliecrawfordmd. Some of those questions will be answered on Instagram, some here on the podcast, and some in the weekly newsletter at nataliecrawfordmd.com/newsletter.
Hi, Dr. Crawford. My name is Claire. This is a call just after the election results have come in and Trump has won. Just wondering if you are suggesting patients move embryos from red states to blue states, or is there anything that you think would help prepare women to use embryos in the future, whether it be red state or blue state, or what, possible legislation could look like in the future, whether passed at federal or state level. Just, there's no way to predict the future, but just wondering the future of IVF and what that could look like, and if there's anything that we can do now to help make decisions better in the future. I do live in a red state, Indiana, and currently we have an IVF carve-out in our personhood law since we already have one, but still not super confident that that will always be the case. So just wondering how IVF patients, past, present, future, can help, what they can do now to hopefully lead to success and be able to use their embryos in the future. Thank you.
There are a lot of really great questions, and I don't have all the answers. The first thing I'm going to say is that absolutely nothing has changed. It is November the 8th. Nothing changed after the election. In every single state, IVF is functioning just the same. I know the essence of the question is about what could happen in the future. And I think it's important to understand before we dive into this discussion that these are things that potentially have been campaigned on, or people who might be in the administration support, or potentially the president-elect has said he supports. What is actually going to happen, none of us know. But it's good to start thinking about and preparing yourself for different scenarios. So we're going to tackle a few different topics when it comes to reproductive rights, and I'm going to give you my thoughts and what I would recommend. The first thing is that let's talk about IVF. So we'll dive into IVF first, since that's the essence of this question. IVF right now is at its most successful that it's ever been, especially IVF in the United States. We have great access to technology. The field is advancing. We have the ability to genetically test and freeze embryos and help people get pregnant later and synchronize the embryo and the endometrium and really incredible things. All of the potential fear about reproductive health stems from the same general concept. Now, it's interpreted in different ways, but let's even say abortion itself. Everything stems from when does life begin? And this subset of people And maybe it's you, right? When does life begin? A subset of people who believe life begins at fertilization. When are all the times life could begin? Fertilization, implantation, a heart beating, a brain formation, breathing on your own. You could live outside the uterus. You are outside the uterus. You take a first breath. Variety of different answers there. I'm not saying which one's right or wrong, but a lot of the reproductive health restrictions all strive from the idea that life begins at fertilization. You and I know that at least in the reproductive health world, because we see embryos all the time, most embryos that are formed, most eggs that are fertilized with sperm, do not ever make it into a usable embryo or make it into a live-born baby, even when we really, really want them to, because that's what I do. I would love it if that was the case. So that argument I have a hard time with, but that's not the point of this discussion. If you believe that, if you believe that life begins at fertilization and your idea with what that means to reproductive health is going to extend in many different facets. So IVF, the most restrictive version would say that life begins at fertilization, meaning any egg that I put together with sperm has got to be put into your body. And this is not far-fetched because other countries who have had very religious mandates on IVF have done this. It makes IVF harder. It takes longer. You often would have to discard or freeze excess eggs, only fertilize a few, 2 or 3, because anything that makes it to an embryo, you're going to put into somebody's body. It eliminates genetic testing, and it is just a more expensive and a longer path to pregnancy. And it doesn't help overcome some of the factors that my patients have. This would mean you'd go through an egg retrieval, have a fertilization of 2 eggs, put those embryos in a fresh transfer, and if it didn't work, have to do another egg retrieval or potentially thaw eggs and fertilize them with sperm. There's an even more strict idea, harsher idea, that, well, IVF shouldn't exist at all because it's playing God. Putting eggs and sperm together, that whole idea, some people are just drastically opposed to it. If we go next, we have people who are just completely opposed to any type of manipulation of an embryo because it's life at fertilization. Manipulation includes freezing it or biopsying it for genetic testing. When we come away from that, we have the version of what about the embryos in excess? So not wanting to have excess embryos. Any embryo that's made has to be transferred. That's hard to regulate. It's easier to regulate, well, you just can't freeze embryos. It's harder to regulate, well, any embryos that you make, you have to transfer at some point. Maybe not today, but in that person's lifetime. Personally, I see patients make this choice a lot. If to you, life begins at fertilization or implantation, and you do not want to have excess embryos, we talk about these scenarios. One thing that I've been very vocal on is that this should be a choice between you and me, and we should talk about it, and you should make what's right for you, knowing that any of these modifications often make the process a little bit harder if you're fertilizing fewer eggs or if you're limiting how many eggs you stimulate, which is another way people go about this. They just purposefully don't get all of the eggs. So if you go into, well, any embryo that is created, I want to give it a chance at some point, maybe not now. You're saying I'm okay with embryo freezing. You may or may not be okay with embryo genetic testing. Maybe you say all normal embryos, I want to give them a chance. Or maybe you don't agree with genetic testing. But you can choose. You still can limit how many you potentially fertilize. It's usually a much larger number, depends on your age and your family goals, and could keep excess as eggs in case it doesn't work to make them into embryos later if you have said excess. And I have patients who are, on their 4th baby or so with me because this is how they feel. And that's great. IVF has helped them grow their family they otherwise may not have been able to. And it sits with their ethical needs or their religious beliefs. But on a government level, if you're trying to regulate this, that one's harder. But you could come in and say, well, you can't get rid of any embryos. What does that mean? You just have to pay for them indefinitely, or you transfer them? And then there is something called a compassionate transfer, which gets overlooked in this arena where we put an embryo in at the wrong time of somebody's cycle so it can't work. But one of the southern states does not allow embryo discarding, and clinics there have to ship embryos to a different state in order to throw them away. That's right, not to store them, not to use them. They simply send them somewhere else so that they can be discarded. So if you want to regulate discarding embryos, that becomes a little murkier, because what if somebody doesn't pay their storage fees? It costs money to keep embryos in space, and you can't get rid of them, but they're not paying for them. Are they allowed to just be donated to anybody? There's so many questions on that one. When we look at IVF carve-outs in different states, so I'm in Texas, and I know Claire, who left her voicemail, is in Indiana, and she said she has an IVF carve-out in her personhood bill. What does that mean? A personhood bill is typically a bill that says life begins at fertilization, essentially making parts of IVF very complicated, and it eliminates almost all types of abortion care because that is considered a life. Now, an IVF carve-out is where somebody says life begins at fertilization, except if you're doing IVF, because we don't want this to restrict IVF access because we want to help people have families, which sounds a little bit like they're playing both sides here, but Texas has an IVF carve-out, Indiana does. It is a more palatable way to get a personhood bill or a very strict abortion bill passed. IVF carve-outs say different things. So in Texas, for example, nothing is to prohibit IVF from going on in normal fashion, but if a dispute shall arise over the disposition of an embryo, a judge shall side for whatever's in the best interest of the embryo. What does that mean? That is what's in the Texas carve-out. So that means if you are married and you make embryos, and let's say you get divorced, before you do IVF, you have to tell me what's going to happen to these embryos if you get divorced. Does one partner get them? Does the other person get them? Do they go in the trash? Are they donated? What's happening to them? So you've already declared what you want to happen when you are happy and getting along, and now you are getting divorced, and as part of that divorce, embryos are considered property still. So you're dividing them up. But if there's a disposition, and let's say Susie wants to throw them in the trash, but Bob wants his new wife to be able to use them, a judge might look at this and say, well, Bob wants to give them a chance at life, and Susie wants to get rid of them, and the best interest of the embryo is to go with Bob. That's mind-blowing to me, but that could theoretically happen. Thus far, it has not. It has been challenged. A case was going through the Texas courts but got stopped. The Texas Supreme wouldn't hear it. Very similar to what I just described. And Texas court said, hey, you already decided this. There's no dispute on disposition because you already decided disposition, which I think was the right answer. But based on our IVF carve-out, you could see how this leaves a gray zone. States that don't have an IVF carve-out have the risk of what we saw happen in Alabama. In Alabama, what happened was that some embryos were destroyed. People sued saying that those embryos were a life, and that went all the way up into where IVF was shut down because a clinic can't be liable for potential homicide, or can you transport something that's alive? It definitely interfered with normal process of IVF. Now IVF is proceeding as per normal in Alabama, but it definitely highlighted some of the vulnerability of IVF when it comes to abortion bills or the large camp of people, much larger than we thought. We just saw how the election went. The large number of people who believe that life begins at fertilization or are totally okay with a severe restriction on reproductive rights. So in states without an IVF carve-out, it has become vulnerable. Depending on what other bills may go to place, are we really going to allow reproductive rights to be decided at the state level? There's a lot of talk of it being decided again at the national level in even a more restrictive way. I don't have a crystal ball. I hope that doesn't happen. There's a lot of different nuance here that we don't know the answer to. So what do you do with this information? First, I need you to understand that there has been legislation proposed that completely protects IVF, would make it a carve-out throughout every state. It was rejected. There's legislation to help provide insurance coverage for IVF. That has been rejected. There have been many times where the people who we have put in office could have stood up for the ability of you to grow your family with IVF or reproductive technology, and none of that has passed. You should follow along. Groups like Resolve, ASRM, Doctors for Fertility. You should be a voice about why reproductive health is important. But on a personal level, what should you do more than that? I would not make any changes at the moment. I would not make any changes. So if you're going through IVF or you're planning to go through IVF, I would go through IVF. We'll have to see what happens. Very little, especially in a state like Indiana, Claire, or here in Texas, where you do have a carve out. It would take time for anything to get passed that would make a big difference. Alabama was more vulnerable. They didn't have that protection. That's why something happened so suddenly. But I would not ship my embryos off to somewhere else at this moment. There's no saying that there wouldn't be some national restriction. I would know where my embryos are. You'd be shocked how many people don't. So I'd know where my embryos are. I would get rid of any embryos I don't need. If I am done with my family, for sure, discard them now or donate them if that's what you want. If you no longer are going to use embryos or you have abnormals that you're not going to use, I would get rid of them now. If you're going through a divorce and you both have said you want to get rid of them, get rid of them. Do not let that be left up to a court. As far as going through IVF, I think that we're either going to see extreme restrictions on how you can even go through the process or restrictions on disposal of embryos. All the stuff in between is going to be really hard to regulate. So I'd go through it sooner. I'd go ahead and make embryos. I would genetically test them if that was something I was thinking about. This would not be the time where I would say, I will do that next summer. I would do that sooner than later. Not that I think anything would honestly happen that soon, but if that's on your to-do list, I would do it. So know where your embryos are. Know how to pay for them, if they move them anywhere. Is there somewhere that your clinic sends for offsite storage? Is it in that state, a different state? Our offsite storage is in Colorado, for example. So just good questions to ask your clinic. If you're doing IVF or considering it, would do it. I would not hold off on doing IVF out of fear that something may come and change IVF, because that might just make it even harder. Personally, I think embryo disposition is the thing of greatest risk. I think it'd be very unpopular to pull in restrictions on the process of IVF to make it unsuccessful. We would economically lose a lot of money. Millions of babies are born through IVF. It is expensive. It is money into the economy. If other countries are doing it better, you would go there. You would go there. So I think that it would be hard to make IVF less successful on purpose, even though it's not out of the realm of possibility. And certainly if you look at the list of likely, possible, probable that might happen based on Project 25, depending on how you want to take that, restrictions or eliminating IVF is certainly in the realm of possibility. I think the more likely target would be embryo disposition. So don't hold on to embryos you don't need. Embryos that you do have, know where they are, and know if your clinic might have a certain offsite storage. If you're wanting to get pregnant, what about pregnancy and contraception? If you're wanting to get pregnant, it's a scary time to be pregnant. Pregnancy is always scary. You've heard me, you've heard others say pregnancy is not a health neutral state. And certainly one of the things here in Texas that we've seen is pregnancy complications, which can arise. And this can put mother's health in jeopardy. That is 100% for sure. Things like premature rupture of membranes or previable hemorrhage. You can have lethal birth defects, placenta accreta, placenta previa. There are terrible situations. The partial molar pregnancy that I saw in fellowship, twin pregnancy where somebody so wanted a baby, yet she had a mole also, and she was in thyroid storm, hypertensive crisis, was dying before my eyes. And she had to have an emergency abortion in order to live. And it was terrible. She didn't want it. It was a desired pregnancy, but she was that sick because of the placenta. You've got to understand that medical care cannot be regulated by these blanket policies that do not make sense and are not made by lawmakers. We must keep talking about it. We must not let this become a national issue. We are at least in the place right now where my patients, my fertility patients in Texas, can go to other states and still get help. I have patients who are trying to get pregnant who these abortion bills have impacted because of pregnancy complications or fetal anomalies. Case of conjoined twins, case of a baby with no brain. These things happen, and they're already one of the most devastating things that you'll ever go through, and now it's being compounded. But at least you can go to a neighboring state in most circumstances. Obviously, in emergencies, it's really different, and we're seeing really an increase in maternal mortality. We're seeing many other things. I'm not trying to go on and on about that, but we've got to pay attention to a national abortion ban is a potential possibility. We've heard President-elect say it's going to go back to the states, but we've heard other people in the camp say they want a national ban. So I think we've got to be very mindful and aware of what that would mean for access to care and maternal mortality in this country. So what would I do if I wanted to get pregnant? I would get pregnant. It might get worse before it gets better. It might be the same. Nothing might change. This is the same answer I give to people who are asking me, when should I grow my family in medical school or residency or training or my job? You've got to make the decisions that are right for you and right for your family. Pregnancy is not health neutral, even in the best of scenarios. We can't make life-altering decisions because of something rare that might happen. Should you maybe have a plan? Should you get prenatal care? Should you be able to know where you might go if something devastating happens? Should you support your friends and your family? Absolutely. But if you want to get pregnant, I would work to get pregnant. That's what you should do. I do not think that other fertility treatments would be necessarily impacted. Things like ovulation induction medication, Clomid, letrozole, intrauterine insemination like IUI. Because none of that is truly involving fertilization still happening in the body, it would be such a stretch to imagine that people wouldn't have access to lesser successful treatments. The problem is it's lesser successful. It is not going to help you with severe male factor. It is not going to help you with tubal disease. It's not going to help you with age-related infertility. It's not going to help you if you have genetic abnormalities. There are certain circumstances where IVF is the only thing that's going to help people have a family. And anybody who's gone through IVF knows how hard it is. But I wouldn't be fearful of full restriction to fertility care or treatment. I think IVF could have some restrictions, more likely on the embryo scenario than on the whole process. But we've got to make sure that the people making decisions understand what the process is. I would get pregnant if I want to get pregnant. When it comes to not wanting to get pregnant, if you believe life begins at fertilization, you are not okay with birth control pills, IUDs. You are not going to be okay with any option where egg and sperm could come together and implantation does not occur. So I think we have to be aware that birth control pills, IUDs could be limited. Plan B, the morning after pill, emergency contraception absolutely would be a no-go. And what does that mean for you if you don't want to have kids or you want to wait to start your family? If you are done with your family, you have kids or you do not want kids, you know that, permanent contraception is the best choice. A vasectomy is the absolute best if you're married. Tubal ligation or salpingectomy, removing both fallopian tubes, is a quite simple procedure. And longer-term options such as IUDs can be great solutions. If you're on the birth control pill and that's what you like, I would ask for multiple months at a time. So just make sure that you have a few months in case there is a shortage or something happens. You've got more than just 1 month. You do not need to stockpile 5 years of pills, but I would try to see if you could get a longer prescription for them. I would get Plan B. It's over the counter. Again, don't stockpile, but I would have some on hand. And there are options where you could get potentially early abortion pills by mail. You can look at some of those websites online and you could have those on hand in case you needed them. There are companies that would allow you to get them for the future, just in case. So those are ways that you could potentially have more, right? You could have more pills or access to ways to take a little bit more charge of some things that can happen that sometimes are out of your control. What if the condom breaks? That can happen to people. So make sure that you've got options if you're not ready to start your family, or consider a really long-acting contraception or things that have higher success rates. Remember, the birth control pill needs to be taken around the same time every day. So be mindful of that and set an alarm and be really good at taking it. There is a lot of chatter about period cycle apps and tracking apps, and if that's bad and if that's good and what does that mean, and are they taking your data and can that put you at risk? I love tracking apps and I love tracking technology because understanding your body and your own cycle and your hormones is the number one most important thing you can do. And I will be releasing another episode on the basics of that. But what does that mean about pregnancy and when your period starts, and how can somebody use that against you? I think these are questions of concern. I've had patients who have some of the pregnancy tracking apps that are cute, like your baby's the size of a blueberry or a grape or a gummy bear, now come in and ask, what state do you live in? Well, why do you want to know that? That makes me nervous. So I think that people have a right to be slightly paranoid about some of this tracking technology and the access to data and information it gives you. However, people have so much access to data and information about us. That's just the truth. Your texts, everything's in a cloud. So in the same light of tracking your cycle, putting you at risk, so are your text messages if somebody's really coming to look for you. I would be more supportive of period tracking apps to track your last cycle, to understand your hormones, understanding your fertile window, either to have sex in it if you want to try to get pregnant or avoid having sex. Remember, calendar method is best in regular cycles, but I might be a little wary to be putting in the I got a positive pregnancy test, especially if you are in a state that has restrictions. And maybe that's just not something you track online. But if that's the same case, remember your digital footprint is very big. So I think we've got to know where else is there information that people could track you if they were really wanting to. But on that note, I would have a better plan on, am I trying to get pregnant or not? If I'm not, what am I doing to prevent pregnancy? What do I need to maybe have on hand if that's something I want to? And understand your cycle. If you're not on hormonal contraception, your period is a vital sign. When you ovulate can be predicted. This is something that you should absolutely know to understand your cycle the best, either to help you get pregnant or to help you prevent a pregnancy. There is nobody who is responsible for this information besides you. In fact, you might have limited access to some of this information, which is scary. So you owe it to yourself, no matter who you voted for, no matter if you're trying to get pregnant, no matter what you believe, because I believe you're entitled to your beliefs. When I have patients who have beliefs that make IVF challenging, we talk about it. And sometimes there's a way that we can make the process actually suit them really well. And sometimes there's not. Sometimes it's not the thing we choose. But that's the thing about beliefs, that they are personal. You've got to know where you stand. You've got to know why you feel that way. You've got to apply the same belief to all the scenarios. Otherwise, it's not a real belief. And you've got to prepare yourself for it. We've got to take judgment out of this equation because we're all in the same boat when it comes to our reproductive health for ourselves, for our daughters, our friends, our family. It all starts by talking about your body, talking about your periods, talking about the reproductive window, talking about how conception happens. We've got to destigmatize that part of the process so that people can understand, how does birth control work? How do IUDs work? How can that help me? Maybe that's something you want. Maybe it's not, but it should be your choice. Should not be universally outlawed. I'm nervous about some of the things that potentially could happen. I am. Am I telling any of my patients to do anything different? I'm not. I'm really not. And if I was, I would tell you this. Have I had patients reach out to me this week? I have. I have had patients delay their cycles or move their cycles forward faster. I've had people ask, should they move their embryos? I've had a lot of questions because if you're going through infertility, you've been let down before. You know the road is unpredictable, and you know you can't plan for every scenario. The unpredictability of more restrictions on reproductive technology, access, or rights is scary. But at this moment, nothing has changed. So I would not make any changes. I'd have good rapport with my clinic. I'd get pregnant if I want to get pregnant. I'd understand my body. I'd understand my contraceptive choices. I'd understand what the rules are with embryos in my state and where they are stored and where they can go. And if I don't want them anymore, I would get rid of them. But at this moment, I'm stressing that nothing has changed. So even though there's a lot of uncertainty about the future, and I will be talking you through whatever may come our way, right now is the time for education and support. This is the time to learn those questions about your body, research, take the course, listen to the podcast, read the blog, dive into becoming the own steward for your health. You need to understand your body the best. And then when we face potential challenges that may arise, potential restrictions on reproductive care that hopefully will not come to light, but if they do, you will at least be ahead of other people because you'll understand your body, you'll understand your cycle, you'll understand IVF, and you will be at the spot where you can know what choices you can make and how to protect your future in the best way possible. I know emotions have been really high this week for everybody on a lot of ends. Even in my own Instagram posts, I saw more hate in the comments and had to turn comments off, which I've not had to do for years. America's emotions are at an all-time high. I hope that we can all agree that health education should be universal, that you deserve to understand your body, and that it's nobody's responsibility but you to start that process. From there, we can advocate together, we can make decisions. Hopefully, we can be a voice for reproductive health together and share stories and explain why you deserve to have control and autonomy and choices when it comes to your fertility and your pregnancy and your reproductive health. But at this moment, let's start by saying nothing's changed. We don't need to freak out now or make changes. We should start asking questions and educate ourselves. And we should know what is out there and what can we do. We should become stewards for each other and support each other. And we should be the voice for this community because if you've been through infertility, you know. If you had to go through IVF, that you didn't know what it was till you went through it. And that people on the other side have no idea. So we're going to give them the benefit of the doubt that they just don't know. And a lot of them are going to end up in the shoes where they eventually do. And we're going to embrace them and help them just like we would anybody else. And I have faith that we're all going to get there together and that our rights are not going to be taken away. But at the end of the day, let's at least support each other and start with education. Sending you lots of love. It's been a heavy week for me. As always, you can get more information on the YouTube channel, over on Instagram at nataliecrawfordmd, questions on Mondays, or you can call and leave your own question at 657-229-3672. Thanks, friends. Thank you all for listening to As a Woman. It would mean so much if you could rate, review, and follow the podcast to be notified of new episodes every Sunday. I hope you learned something new, and I hope you share it with someone in your life. Be sure to follow along on Instagram at nataliecrawfordmd and check out the YouTube channel Natalie Crawford MD. If you're interested in becoming a patient, you can also follow Fora Fertility. I'm so thrilled to have you here, part of the community that amplifies others as a woman.